My name is Bent Gay with Gayco Healthcare. We're a long-term care pharmacy. We've been in business since July 1st, 1993. We first got into long-term care when a friend of mine who had a retail pharmacy was ready to sell a long-term care segment that he had. Was I interested in buying it? I told him I would. We sat down and looked. At that time, there were 4 facilities that they had. And we went into business. It was myself and one technician. And on July 1st, 1993, when we opened up the doors, we walked in, and then today we serve nursing homes, skilled facilities, correctional facilities, assisted livings, and personal care homes throughout the state of Georgia. When I went off to college, I knew I was going to be in some form of health care. Was not sure what that would be until my senior year of college. I decided to go into pharmacy because I enjoyed helping people, but I also enjoyed the business side of medicine. The first things you'll see when you walk in the doors at Gayco is you'll be greeted with a smile at our receptionist. Whether you're on the phone or in person, you're going to get a smiling face on the other end. Then you will see that you're in an area and all of our administrative offices around you. These are here to make sure that we're able to take care of our current employees and our customers, which are the residents. As you walk into the pharmacy, you will notice that we've got an area where the pharmacists are seated and the technicians are working around them. They're all able to communicate with each other, able to talk about issues that may come up, to, if they're unsure of a situation, to discuss that with each other. As you look to the sides, you will see that you have technicians that are hard at work. They're going through several steps to make sure that the right medication is given to the right person. Now you'll venture to the back and you will get to see another group of pharmacists seated around that are looking after and observing the IV room, observing the liquid section, the non-oral sections. As we started looking at the vision for the future, how could we do that? How could we provide a better care for those residents? And we've decided to go through about a year of studying with a strip pack program. The one that we chose is the ATP machine made by TCGRX. What we were looking for is a way to be able to bring an individual care to a patient that's kept in an institutional setting. What this ATP machine actually does is it will take the doses of a person that they're taking and they put it by the times of day that they have. We're able to then go in and then ship that to the patients, and it allows them to then be able to take the right medications at the right time by the right resident. How can we double check that? What we did is we found a product called Inspect RX that once we have produced the pack, it then is run through the Inspect RX that now knows the exact size, shape, color, and dimensions of that pill. And if it has any doubt whether that's the right pill or not, it will flag it. So we still have human intervention in this, which is very important. They still look at every bag to go through, but it's the best of both worlds. It's technology and automation married together with the benefits that only a human can bring. Now we'll walk into the delivery room. This is an area where the last check happens by our pharmacist. The pharmacist checks the med, and every med is looked at before it leaves the facility to make sure that each resident is getting the right medication. The delivery room is the last stop before the meds head out to our facilities. Welcome to our purchasing department, where our ladies work real hard to make sure that we've got the lowest cost meds on hand so that we can provide the best prices to our customers. Now we head into our medical records facility, where our staff provides accurate medical records and any reports that may be needed by our facilities. Next, we go into the billing department. These ladies work hard to make sure all of our bills are accurate and timely for all of our facilities. An additional unique benefit of Gayco Healthcare is our on-site child care, which displays our commitment to family. This business has changed in that it used to be very commoditized. It was you had one product that everybody could provide. You put pills into a bottle or into a card and you shipped it out. It's not anymore about can you get in the meds, but can you take care of the resident? Can you provide what the nurses need for the better care of their residents? That's the biggest part that we've seen change over the last 20 years. The unique approach that we bring to long-term care is the belief in doing things the old-fashioned way. That is the customer service. We're here to help the facility. We also want to go in to make sure that we're bringing the most up-to-date techniques, up-to-date programs, and up-to-date knowledge to make sure that the end component, which is the resident, is cared for.